Just Free Community, one of our most anticipated awareness pretty soon. Just Free Community, we need to do that. We will lead sustained abuse prevention through structure. As I said, I think I just make a contribution to one of the questions. All of our work will do, it will be structurally arranged. Because what? We are health institution. We have Ministry of Health. We have the National Public Health Institute of Liberia called NPHIL. We have Maryland County Health Team. We have Partner in Health and other health institutions that we work in collaboration with. So whatsoever thing that we will do, it needs to be what? Structure. Like our jingles we have on Radio Kipamos for a bi-weekly radio talk show. We face a jingle. That jingle was sent to the Ministry of Health through Maryland County Health Team. It was approved before we play on radio. Because every single statement you made from your mouth on the radio, it needs to be approved by Ministry of Health. What happens? Because people are out there listening. And what you are saying they are going to do it. What if it harm them? It will not be good for the image of the organization you work for. So what we will do, all of our programs will be what? Structure awareness and campaign. Radio programming that we're currently doing in partnership with Liberia Justice Enforcement Agency at all levels, which we have already sent them partnership document already to partner with Progressive Health because we need to embark on drugs awareness. Next slide. So quickly, we will look at collaboration, building partnership. Field Incorporated believes no organization can transform community health alone. Like what I told you, one person cannot fight this battle. What happens? Strategic collaboration multiplies impact. If we are grouped together as a team, we can make impact. There is power in unity. Then one person. First of all, we'll look at the government. What happens? Ministry of Health, NPHIL, Gender and Child Protection Ministry, Liberia Justice Enforcement Agency, LDA, and counties' health authorities. It could be any county where we will find ourselves. The next one, we will have media and radio. We will not leave it out because social media burning is one of the things. That's why I always give credit to the media team, to Mr. Thomas D. Weir. Please put your hands together for him. He's actually doing well. Phil has an official website now that you can browse and get all of our information through the media team. Thomas D. Weir, established the website. It is a plus for us. So we will not play with media and radio. Local radio station providing platform for health talk shows and major awareness program. Now we live in a digital world. So anything you do, if it is not captured on a digital platform, you are not doing anything. That's why we are taking it very serious. And as a young institution, we are looking for fundings. So we need to take this one very serious for people to see our impact in order to come and join us in this fight against disease and promoting health. Local communities, district leaders, community leaders, youth association, women groups across Liberia and beyond. These are people we are targeting to work with. These are people that live in the community. The women group, the youth group, the district leaders, the community leaders. We are going to work with them both in Liberia and out of Liberia. As you may be aware, we have a lot of members out of this country at the level of field. Some of them are in our chat room. And before I close, I'm going to tell you that. Then we have NGOs and civil society. We have other society organizations that are civil society organizations. We are also willing to work with them because they are health-focused, not-for-profit NGOs. The RNOs are international NGOs. We have like Partner in Health, Street Child Internationals. These are RNOs. CBOs are community-based organizations like Field Incorporated now. We are community-based organizations. Religious group. We are also going to work with religious group. What happens next? We provide technical support, training, and joint outreach, and etc. Like what we are doing, we are providing training for ourselves in order to go in a field. We will conduct this training every time as organization when we want to, because it helps to abreast us, to keep us activated with new knowledge and bringing up new ideas in running our institution. Next slide. Then quickly let's look at impact, stories, and data. Field was founded 2022 from the day one, building from day one, from the first day, July 2nd, When Phil was founded, that same day, we can remember on a table, we begin to plan what to do next. So we started from the day one. What happens? Counties reach. Currently, we work in 2 counties, Mosurado and Maryland, and beyond. The beyond is the social media that we using to capture other people out there. Then we look at, you see, 1,000 plus. We have reached over 1,000 plus life has been touched with the work of Phil currently since its inception. 2 outreach programs. We have 1 plus radio outreach. That is to say, for now we running only a radio program in Maryland County, but we are deciding to reach other counties. That's why it is 1. So few impact stories. In Harper City, Phil Incorporated partner with the Maryland County Health Team to host a landmark community menstrual hygiene awareness event. Local youth, parents, teachers, and district health officers gathered to learn about the importance of menstrual hygiene and issue tearing through communities. The event sparked a wave of conversations with community members requesting follow-up radio programs and school visits. This is a rapid effect Phil creates, one initiative that grows into involving movement. This program was not an easy program. It speaks a lot of volume. If you go on Liberia Investigator, it is a newspaper. If you go there now, you will see how the people carry this program live and what they posted concerning that program. Volunteer motivation and commitment. You did not choose community health because it is easy. Every time we will call you. Sometimes when you see our calls coming, you will bounce it back. But we beg you, we are together in it. If it costs us to even come to your houses and beg you, we'll do that. Because we want this to come to reality. What we started and we will continue is not a play. It is not easy. It has a lot of responsibility, sacrifices, financial burden. Sometimes we'll say that everybody paying 500. It can be easy. Looking at the economic, but we will have to do it because we want to serve humanity. Serving humanity is not an easy thing. So propose a purpose over paycheck. One of the reasons for which you join Phil is you have chosen purpose over paycheck. We are not going to give you check to go to the bank. You have chosen that. At Phil, every volunteer carries a vision larger than themselves. Phil is bigger than you once you are here. We are driven by love for community, not reward. There is something that we saw. That's why Phil was established. And this thing that we saw needs to be worked on. Go with Phil. But Phil is going to invest in 8 people. And just underline that particular word. This institution is going to invest in 8 people. And what happens? Leadership opportunities will come at the level of Phil. Skills training will come. And personal development awaits committed members. Other people can start, but they can't end something. Other people, you see, we have different blessings. Other people can just come at the end of certain thing where the thing is already getting to a higher level. Some people will come. So there are other people who can suffer when they reach in the middle, they break down. But we pray and ask you today that you will be one of the committed members of Phil till the end. And then you will reap what you are sowing today. And the next thing, you are the change. Take yourself to be the change. Don't say that as a from Phil. I'm not the one who from Phil. You from Phil. Phil is for everybody. It's just that before something happens, one person just have to bring the idea. But it mean that it's for that person. It's for everybody. Once you are a volunteer of this institution, keep it up. Keep in mind that you own the organization. Every house visit you will make at the level of this institution, every radio script, like you follow us in a studio, any statement you make, every awareness flyer you distribute, like we will be printing them in good number. Every awareness flyer you distribute is a seed of lasting transformation. Remember, anything you do today at the level of Phil, your community members are looking at you. Your name is already recorded in their book as one of the person who came yesterday and told us that sleeping on a mosquito net is essential. 7, leadership. We want for us to be a servant. Every one of us, we want to serve. We lead by serving. The greatest leaders are those who live others. And I feel that is our daily practice. Servant leadership. Belonging to a movement. Here, let's know that we are part of a group. We are working together. You should not go and tell somebody that I think they're doing, they get me to be there, but I'm ready. Tell them we get an organization. Tell people this is our organization. I join them willingly. And I believe in the vision of that organization. Don't look at people who are in the organization. I beg every one of us as volunteers to read the vision and mission. Our next thing is we are about to share the bylaw and constitution on every member of the organization. It is that bylaw and constitution you will be reading. Read, look at what field want to achieve. Don't look at people who establish field, but look at what field want to achieve to save lives in our environment. So, you are not just a volunteer. You are a founding member of Health Revolution in Liberia. This is a health revolution. Once you are a volunteer of it, keep it in mind that you are one of the founders. And field is still in a growing stage. So, every one of us who are volunteering today, we are establishing an organization. There are a lot of things field need. So, you should be legacy builder. You are a legacy builder. Anything you do, your $5 you pay today, it is a legacy. We mark them. We have receipt to that. We save. If you want to get record on everything, they just go and download them and bring them back. That's what we're doing. So the work you do today will be remembered for generations. Don't overlook it. Your name is written in the health history of your community. If you live in Nikambo, if we go in Nikambo, like how you in your t-shirt, you go, they take your photo, even we post it. Those who posted photo 10 years ago, Facebook still have it today. And it brings remembrance of them. So your name is registered in the history of health in your community. If you follow what you are doing today, you're taking it for granted, but you are making impact in the world. So clap for yourself for that.